Good evening, good evening. If y'all want to grab one last quick bite to eat and then have your seat, we're going to go ahead and get things started tonight. My name is Nick Marino, and I'm the Director of Marketing at Curis Functional Health. And we and the Communities Foundation of Texas welcome you to tonight to Destigmatizing Mental Health. So thank you so much for joining us. Give it up for yourselves. And also, if you are joining us online, we welcome you as well. We have people from everywhere from Kansas City, Missouri, down to South Texas, to West Texas, and even beyond that, joining us on a live stream tonight. So we welcome you as well, and thank you so much for joining us. But tonight, we're going to be talking about mental health. The month of May is actually Mental Health Awareness Month, which I don't know if you know that or not, and I will let you guess what color represents mental health. Pink. I'm kidding, green. It is green. I still do not actually know why that is the color. I probably should look that one up, but we're wearing that tonight. And there's a lot of stuff going on around that this month, whether it's with us or if it's with NAMI. And then I'll go into a little bit of what the Communities Foundation is doing as well for mental health inside of our community in North Texas. But I first want to say, what is the Communities Foundation? I've gotten that question a few times. Who here has never been here before? First time. Timers? All right, we have a few online, still never been here, right? But the Communities Foundation has been a partner with donors for raising the quality of life in our community for over 60 years. Communities Foundation of Texas provides effective ways to make meaningful charitable contributions while realizing significant tax advantages. CFT handles the investment of the gift, listens to the donor's priorities, and manages charitable grants to worthwhile causes. The value of a gift can be granted out completely in a short period of time, or it can be nurtured to provide a long legacy of charitable support. The Foundation's experience in the nonprofit community and with donors results in a unique relationship with powerful benefits. As the name implies, a community foundation is a public charity created as a vehicle for charitable giving. The defining characteristic of a community foundation is that it represents the donor's charitable interests and adds value through its wealth of community knowledge, along with the leadership of its board of trustees and the services of professional staff. And speaking of board of trustees, we do have one of their board of trustees, Greg Campbell, who's with the Curis Functional Health team as well. So he's here this evening with us. But one thing that you're probably like, there's something that's huge that goes on every September. Who runs that? And that big thing is North Texas Giving Day. It's the #1 donation day in Texas, and I think in the United States, actually, for nonprofits all at one time. And that is all put on by the incredible team of the Communities Foundation. We have a table in the back with them right over there if you want to wave and say hello. If you have any questions about the Communities Foundation, I'm sure they'll be able to answer those. But the North Texas Giving Day actually also helps over 3,000 organizations, and they'll be celebrating 15 years of it this year, and over $500 million raised for nonprofits in the North Texas area, which is an incredible number that provides incredible work. And we do have some individuals here from our nonprofit community tonight. If you are part of our nonprofit community tonight, can you stand really quick? Can you stand just so we can recognize you? And from the nonprofit community, like some of y'all, yeah, come on, I know, there you go. You'll get to hear from them a little bit later on this evening. But also, our other host is us, Curis Functional Health. So what do? We're an integrated healthcare concept. We have over 56 plus locations and growing rapidly through Kansas, Chicago, Texas, Colorado, and all across the US. And we integrate physical, mental, nutritional health all together to focus on the whole body. And Deb's guy won't steal Deb's thunder. She'll be talking about that a little bit more. And speaking of Deb Campbell is the co-founder and chief visionary officer of Curis Functional Health, which has been distinguished as the 10th fastest growing healthcare company in the 2022 Inc. 5000. She is passionate about the nervous system and taking a whole person approach to wellness. Debra envisions a world where clients receive a proactive, multidisciplinary approach that empowers them to make educated decisions about their health and wellness. With 20 plus years in private practice, Debra is an expert in couples counseling, elite domain performance, sports psychology, and positive psychology. She is certified PACT couples counselor, level 5 ETT practitioner, psychodramatist, I probably should learn how to say that one a little better. Putting all these SAT words inside of your bio over here. She's the co-founder of the Relational Therapists of Dallas and has worked with the U.S. Olympic Training Center and USFSA. She is an active member of multiple professional groups and has done many presentations and publications. Debra holds degrees in animal physiology, neuroscience, biopsychology, and clinical psychology. She's our keynote speaker tonight. And can I welcome to the stage, Debra Campbell. We got it easy.
All right. Hi, you guys. Good evening. Thank you guys for coming to hear me talk about the state of mental health and destigmatizing mental health. My name is Debra Campbell. I'm the co-founder and chief vision officer for Curis Functional Health. And with that, we will jump right into it. Or try. Where does this point?
I forgot to put my slide up there.
Let's try this. It's okay. I'm like, this first part, I'll just wing it from my computer. We got this. Oh, there it is. All right. I thought I would start by talking about some statistics from Mental Health America about mental health. They do a state of mental health report every year, and these were their key findings for 2023. Over 50 million Americans are experiencing mental health issues. That's 21% of the population. Over half of adults with a mental health illness do not receive treatment. That's about 28 million people. Almost a third of all adults with mental illness reported that they were not able to receive the treatment they needed, and 42% of that was because of cost. Over 1 in 10 youth in the US are experiencing depression that is severely impairing their ability to function at schoolwork, home, family, or their social life. These are depressing statistics. And then, there's the metrics show that there's one therapist per 350 people who need care. That's the slide I need. And that's an average, right? So we have one mental health therapist for every 350 people who need therapy. Well, that's an ignorant metric because it doesn't factor for cost, location, insurance, or anything else. So when you look at the real statistics for mental health in terms of treatment, it's probably one therapist for a lot more people than 350 people. And most mental health clinicians will not see more than 100 people in a year. And that would be a huge metric. That's probably a way overestimation of what any therapist could possibly do. And can we go to the next slide, please? So since we're located in Texas, I thought I would talk about where we stand in the 51 states. And when you look at where we are, we have one therapist for 760 people. It's really a sad metric. And it's impossible for us to meet this demand. May I please have the next slide? So COVID did some things for mental health that really were positive, actually. So COVID destigmatized mental health in the sense that suddenly we were talking about mental health in the media. And people were talking about it with their families and seeking treatment. And it did a lot to destigmatize mental health. It brought up 2 new areas for research, treatment, greater awareness, and higher quality treatment. The first arena was BIPOC. And the second were the gender and sexuality spectrums. And these are historically undertreated, under-acknowledged populations that now are going to receive better treatment because of the awareness that was built during this time frame. Another upside of COVID, virtual therapy became a norm. Prior to COVID, nobody got virtual therapy. It was barely offered, and People didn't really want that style of treatment. There are many upsides to virtual therapy, like it's highly accessible, it's very convenient, you can squeeze it into your day. Cost is low, it's lower, there's no overhead. And you can see a specialist, which might not sound like much, but if you live somewhere where you are remote, you might not have access to an eating disorder specialist or an OCD specialist or someone who treats the style of mental health issue that you're struggling with. So this opened up a whole world of virtual therapy that is still being used today. I have lots of clients that live locally who still want to be seen virtually. It's awesome. And then lastly, unsuspectingly, we got an mRNA vaccine that was pushed through the FDA, and it was pushed through really quickly. And that is going to mean gene therapies for lots of things like cancer, STDs, et cetera. But it's also going to mean gene therapies for mental health. So in the past 20 years, major advances have come through the nervous system. This is the part that gets me really excited. So we have been much better able to study our nervous system. We have better methods to understand what's going on functionally and to treat using the nervous system. We also have had several genetic advancements that have made treatment more personalized and accurate. And we've also had some technological advances that may assist with bridging the gap between the supply and the demand. Next slide, please. And this is our nervous system. For those of you who aren't familiar with it, it's something that gets me really fired up because this is your brain plus your spinal cord plus all the other nerves in your body. And you can see your nerves go everywhere in your body to all the major organs. And your body is just this one giant feedback loop between your brain and your body and your body and your brain. So in mental health, we do diagnosis, and we're one of the only fields that does diagnosis, and we do not study the organ that we treat. We haven't had any methods to study the organ that we treat up until recently. So we do diagnosis and treatment based on self-report of symptoms, but symptoms do not equate to the source of the mental health issue, which could be many possibilities when you understand how the nervous system works. And then diagnosis drives treatment. But if we don't have the right source, are we even treating the right thing? So historically, we have done cognitive, behavioral, and pharmaceutical interventions. But I think the future of mental health is going to look like taking a whole person, multidisciplinary approach to the nervous system, and it's going to be highly, highly personalized. So historically, we would study the brain. We study the brain in parts. And the only things we knew about the brain were through case studies on traumatic brain injury and drugs, like illicit drugs. And so now we are able to study the brain. We've had some advances like MRI, EEG, fMRI, SPECT scan, and PET that allow us to study structure and function. And we're starting to have a much better idea of what the brain actually looks like and how different parts work together to create thoughts, feelings, memories. And there's a project, if you want to go look it up, called the Human Connectome Project that represents just shy of $40 million of research that was conducted to look at the web of how your brain works, different parts work together, the function of your brain. And that's at humanconnectome.org. And this is an image of what the results of that project look like. So it's very, very different from what we used to look at when we'd say the brain. We'd say like, oh, this is where your memory is stored. This is where this is stored in this part. But now we know it looks more like this. This is what it looks like when you're having a feeling. This is what it looks like when you're having a memory. And then I'm going to have to slip quickly through this slide just based on time, but Obama did something amazing, and he funded this BRAIN initiative. It's a public-private collaboration where they're putting $100 million into studying mental health through multidisciplinary research to enhance our understanding of mental health and to develop applications of technologies to help with mental health. We have had two significant genetic advances that have been really groundbreaking in our field. The first one is we're starting to do genetic research to see where what genes are maybe overlapping in different mental health issues. There's been some observation that mental health issues tend to run in families, and that for a lot of different mental health issues, the symptoms are similar. So research is supporting now that there are some common genetic factors for ADD, autism, major depression, bipolar, and schizophrenia. And they're proposing that genes influence your brain's wiring, wiring impacts function, and that for people with these genetics, there's like a vulnerability network that predisposes them to certain brain connectivity that's linked to mental health issues. The second major genetic advance, which might not sound like much, but we're using a saliva swab test to match people genetically with certain psychological medications so that maybe we can get it right the first time when we're taking an antidepressant, which an antidepressant, for example, could take 4 to 6 weeks to, hit capacity in your blood, and it may not work. Like the average rate of hitting it right the first time is 25%. So we can have better treatment outcomes if we're able to match people with whatever medications genetically that are designed for them. Secondly, on this one, we're also looking at genetics in terms of whether you're a good, like a fast metabolizer or a slow metabolizer of certain medications, so we can taper the medication to you personally, so you're not taking more or less than you need. So if you remember that picture of the nervous system that I showed you back at the beginning, your gut is actually a really significant piece of that picture of your nervous system. So there's your gut, there's the actual organs and the nerves that run through it, and then there's a little microcosm that lives inside your gut. So the first thing we're going to talk about is the gut-brain axis. This is 100 million nerves. It's considered your body's second brain. It lives in your gut. These are motor and sensory neurons that line the tract of your GI tract, and they influence your brain, and your brain influences your GI. So your thoughts, your feelings, your stress impacts your digestion, and your digestion impacts your thoughts, feelings, stress. And your gut is also very, very responsible for neurotransmitters, which are the chemical messengers that your neurons rely on for things like feelings. So inside your gut, you have a little microcosm of flora and fauna. These are little microorganisms that help you digest your food. We have, I don't know, some people say trillions, other people say hundreds of trillions of organisms living inside of our guts, and they produce hormones and neurotransmitters, very, very, very important. And so we know that if you have an imbalance of these organisms, or you take an antibiotic and you eliminate some of these organisms, or you are eating food that makes you your body's sensitive to and you're inflamed, then this is actually linked with having anxiety and depression symptoms. And so we're looking at ways to treat mental health using the gut. So one of these options is probiotics, which are yeast and bacteria. And there's research supporting that this is effective for anxiety and depression, standalone or in conjunction with mental health medications. The flora and fauna impacts your cortisol level, which is literally your stress. It may alter the expression of your genes, and it reduces gut permeability, which is inflammation, and inflammation has been linked with anxiety and depression. The second option that we're looking at in terms of treating mental health through the gut is a fecal transfer, and this is exactly what it sounds like. We're taking a small amount of feces from someone who is healthy and giving it to someone who is mentally struggling, and it is effective at reducing symptoms of anxiety, ADD, and bipolar. And they're looking at using this for depression, anxiety, autism, eating disorders, and substance abuse. So a whole new field has been born out of nutritional psychiatry. So like this is the you are what you eat. 95% of your serotonin, which is a very important neurotransmitter for mood, sleep, appetite, and pain, is produced in your gut. And so there are entire research teams exploring different types of foods, different diets, and the impact on mental health issues. So there are people studying short-term and long-term the Mediterranean diet, showing that adults who engage in this for 12 weeks had improvements in their mood for depression and anxiety, and they reduced anxiety. Long-term, it's preventative for neurodegenerative. Keto is being researched for things like epilepsy that's unresponsive to anticonvulsant medications, and older adults, so 60s and up, they're looking at the use of diet for preventing cognitive decline. So there's research to support that taking a multivitamin is helpful, a quality diet is helpful, and taking antioxidant polyphenols is helpful. And I also think there was one about the Mediterranean diet plus nuts and olive oil. this study gets me fired up. Like, this is one of the most exciting studies that I thought happened recently. They looked at the effects of exercise on mental health in people who had mild to moderate depression, stress, and anxiety. And what they found was that exercise was 1.5 times more effective at reducing the symptoms of depression than antidepressants or CBT, which is the leading treatment for depression and anxiety. And what they found was that basically all types of exercise work. And not only that, shorter bouts of high intensity exercise was the best for this. So they're talking like 10 minutes of jumping rope or jogging, and maybe a couple times a day, versus longer duration exercise didn't produce the same benefit. In fact, it diminished the benefits. There were other studies I wanted to talk about, but I only have so much time. So in the therapy world, in the mental health therapy world, we are really excitingly starting to work with therapies that involve the nervous system. So we're looking at the mind-body connection. And this is a short list of some of the therapies that are out there currently where we are working with the mind-body connection. So it's EMDR, ETT, transcranial magnetic stimulation, psychodrama, packed couples therapy, neurofeedback, biofeedback, and somatic experiencing. And I assume that we're going to see more based on the research that's coming out. But definitely the hottest thing going on right now in mental health therapy are psychedelics. And so before you go home and you try this on your own, I want to be clear that these are small studies and they are in ceremonial, controlled environments with supervision. But what's really interesting is we're having profound results in a very, very short period of time. We're talking several hours, several days. And it's highly, highly, highly effective, seemingly, for very hard to treat diagnoses such as PTSD and treatment-resistant depression. So these are people who are looking at years of therapy where we can get something done in a weekend that we previously could not get done in a year. So this is really exciting, and it so far seems to be well tolerated. It's non-addictive. Most of the options are non-addictive, and they have minimal side effects. We're seeing psilocybin being used for depression, smoking cessation, and existential therapy. That's Johns Hopkins. If you want to find out more about what they're doing, they have a really interesting research going on. We're seeing ketamine being used for depression, PTSD, alcohol addiction, suicidal ideation. This is one of the few options that has some risk for addiction. Ketamine is from the methamphetamine family, cocaine. And then we're seeing LSD being used for addiction. MDMA and talk therapy for severe PTSD. They're getting really beautiful results with this with veterans. And then ayahuasca for depression and anxiety. But I assume we're going to see that span out because it is being used in settings for other things. And so as much as technology gets a bad rap, it may actually be a good thing for us in mental health to some degree, because if you remember that supply and demand metric, we have a huge demand and not a lot of supply. And so now there are apps that are being developed for doing therapy on your phone. Most of them are cognitive behavioral therapy for depression, anxiety, positive thinking, suicide, eating disorders, OCD, addiction. And then there's meditation and breathwork apps, once again, tapping into that mind-body connection. So there's a huge advantage to these apps in that the price point is low. They're highly accessible. You can do this in the privacy of your own home. Compliance may be easier because you have your phone with you full time. And some of them may even be fun because they gamify mental health. I'm sure everyone in this room has been hearing about ChatGPT, and ChatGPT is also being used apparently now for therapy. If you go on ChatGPT and you put in, I have anxiety, it will say something like, I'm sorry to hear that you're experiencing anxiety. It can be a challenging experience, but there are strategies you can try to help manage your symptoms. And then it'll pump out a numbered list of things that you can try, like work on your relaxation, focus on your sleep, cut your caffeine and alcohol, challenge your negative thoughts, and seek the support of friends and family. All of this is pretty good advice, especially if you can't afford therapy, or maybe you're not ready to jump into therapy. There are also AI chatbots where you can text with some artificial intelligent chatbot. This is in the preliminary phases. Also, we are seeing the use of virtual reality, which is a computer-generated 3D environment that feels super real. And they're using it to treat things like PTSD, anxiety, social anxiety, public speaking, chronic pain, specific phobias, eating disorders, depression, grief, substance abuse, and compulsive disorders. May not be quite as inexpensive as an app, but definitely packs some punch when it comes to being able to do this in the privacy of your own home. For things like agoraphobia, this could be a total game changer. But there's also some really interesting PTSD research being done with this right now. So in summary, I think we're coming into a new era of mental health where there's reduced stigma. So people are going to go seek help, and we have an improved understanding of the nervous system, which means we hopefully will be able to diagnose better, which will then lead to better treatments. My hope is that we will take a multidisciplinary, systemic, integrative approach to these mental health treatments, and that they'll be personalized based on you, your nervous system, your gut, your genetics. And we're going to be seeing faster results for certain populations that have been historically very hard to treat, and with ceremonial psychedelics. And hopefully technology will fill a gap between supply and demand, and that VR, AI, and apps are going to allow for more affordable treatments that you can do in your own home. And then maybe somewhere in the near future, we're going to see mRNA gene therapies for mental health, which is a whole other realm. So hopefully that's a good quick flyby of where we've been, where we are, and where we're going. And my email was on the first page if you want to talk about this or ask questions. It's very, very high line about what's going on in our field. But I want to thank you guys for your attention and for having me here today to talk about this. It's super important.
Awesome. You can hit that next slide too. But we're going to go a little bit more in depth after Deb just spoke. Thank you so much for that. A lot of interesting information, and we're going to have 4 individuals that vary in a lot of different aspects in the mental health field and see a lot of different things in their everyday work. And what they're actually seeing. But we need someone to ask them the questions. We need someone that's going to do a good job at moderating this panel and guiding that. And I couldn't be more happy to have Laura Harris. Laura is a revered journalist and co-anchor at NBC5 Today. She illuminates the weekday mornings with her Emmy Award and Associated Press award-winning reporting. She joined the NBC5 team in 2018 after earning accolades at ABC affiliates in Tampa and Charleston. Way better here in Dallas, just saying, right? Yeah. And launching her career at WNEG TV and CNN Sports in Atlanta. Laura's commitment to journalism has taken her to significant global events. She's covered the 2021 Tokyo Olympics, President Barack Obama's 2016 visit to Cuba, and Pope Francis's historic visit to Cuba in 2015. Besides her international coverage, she's demonstrated her political acumen at both the 2016 Republican National Convention in Cleveland and the Democratic National Convention in Philadelphia. In Dallas-Fort Worth, Laura pioneered the NBC5 Reading With You initiative designed to combat the summer slide by promoting literacy among elementary-aged children. A summa cum laude graduate and Division I soccer player from Georgia Southern University, Laura's multifaceted background also includes Alpha Kappa Alpha sorority membership and ties to her Atlanta family roots. Laura's journalistic endeavors continue to drive meaningful discourse, demonstrating her powerful impact on the field. Everyone, please welcome our moderator, Laura Harris. And
Oh, better than that. I've been up since 1:30 and I'm great. How about you? We good? Okay.
you don't have to worry about sliding, and Kim starts right there.
Okay, cool. So all of our panelists, we're gonna have you just kind of sit up here with us and we're gonna act like you're on Oprah's couch and we're gonna all talk about this, if that's all right with you. So I like to, when I do panels, I like people to introduce themselves. I think it's really important for somebody to tell you one thing about them that they think is the most important thing that they want you to know today. So I'll have all the panelists come up, we'll all sit up here, and then we'll go one by one. You'll tell us your name, you'll tell us where you're from, and you'll tell us one thing that you'd like us to know about you. Oh, don't be shy. You know if you're a panelist or not. Your picture's right there. Thank you. And it doesn't matter what order you're sitting in. Yeah, it's a lottery system. We're just gonna pick one. So we'll start here with you, Kimberly. If you'll just tell us your name, tell us what your affiliation is, what organization you're with, and something that we need to know about you before this conversation gets started.
So my name is Kimberly Hansley. I work at Curis Functional Health in North Dallas. And I don't know, I'm a mom. I have like 4 kids. So my
Like force, are you sure?
depends on the day.
I love that. That's what my mom would have said.
So that's really influenced what I see and like how I work with people. All right, I guess it's my turn. My name is Prisma Garcia. The one thing I would like you to know is that I'm from the Pleasant Grove community. 75217 is my zip code. But I have not let that define my path. I am the co-founder and board secretary of an organization called Community Does It, which is tackling the stigma of mental health in the neighborhood.
Hi, everyone. I'm Frances Smith-Dean, Executive Director of the Zan Wesley Holmes Junior Community Outreach Center. We're the best kept secret in the hood in South Dallas.
Good evening, everyone. My name is Patrick LeBlanc, and I am the founder and executive director of the Bridging the Gap Foundation. We serve people in Dallas County that have mental health challenges.
Perfect. Thank you all so much for being here. This is a really important conversation that we're going to have this evening. Patrick, I want to start with you. From what you've seen, sorry, just so how I told you it's a lottery system. I was just going to pick it. But what do you see as one of the common misconceptions when it comes to mental health? Especially, it's hard to believe in 2023 that we're still having this conversation, but what's one of the biggest misconceptions?
Well, the biggest one is, we're trying to destigmatize it. I mean, a lot of people think that it's something that doesn't happen to me. I know culturally there are a lot of things that hinder people from actually accessing care. And one of those in the African American community is it's something that we just don't do. It's not habitual. It's something, a conversation we're not going to have about mental health. So, and because of that, and those things that have been passed down from generation to generation, it is really a huge roadblock or barrier for people accessing care.
Yeah, Patrick makes a good point. You think back to just 10 years ago, 20 years ago, and you talk about Black communities especially. We just did a story at NBC5 about how it's usually just pray it away.
Right.
It'll just go away, just pray it away. But other communities are the exact same. And so there has been kind of this stigma of the things that you should be doing to handle your mental health or the things that should be happening to you. Everybody's having a bad day. Everybody feels this way. And it kind of, even though people are trying to help, oftentimes it hurts because it's that thing where I get that everybody's having a bad day, but I'm telling you that there's something different about the way I'm feeling.
And I think that's one of the things that's hindering us is because we don't know how to recognize what it is. As she just mentioned, we don't know what it looks like. This is how I'm supposed to feel every now and then. And because we don't have the knowledge or the health literacy to identify what it is, that creates the problem.
Yeah. That's one of the things that we've especially seen in young people these days. So Kimberly, I want to talk to you about that part. It's without getting too deep into how troubling it is, especially when we had a call just the other day. The police were called out to a woman who was threatening to harm herself. I think she was like 18 years old. What'd they do? They shot her. And it was just so heartbreaking because if that's the first thing I say to you when you come to respond to my call, the best thing to do is probably not shoot me. So you know what I mean? It's just one of those things where we just continue to see these things happening. And especially when it comes to the younger generation, where maybe they didn't get those tools when they were younger to be able to talk about, this is how I'm feeling and I need some assistance.
No, absolutely. There is a big gap, right, between noticing anxiety or someone saying, just get over it. Like, it's fine, get over it. They're invalidated by their parents. They're invalidated by a teacher. And then we have kids refusing to go into a school building and no one's even recommending a therapist at that point. They're just like, oh, we can't get them in the school. Right. And then you have a kid who's like, I've had it. Nobody will listen to me. I'm done. So I'm just going to kill myself. or like, I need help, right? Because
Mhm.
usually if someone's going to hurt themselves, they don't always tell you, right? That's like a big cry for help.
Yeah.
If they're willing to say like, hey, I think I'm going to hurt myself.
Mhm.
They don't want to. That's why they reached out in the first
That's why they
place.
said in the first place.
Yeah.
Prisma, what are you saying? I love how you said, I love how you said that you're from a community where you're not going to let that define you. I've been to a lot of different communities in North Texas. Your area is just as beautiful as any other one. I want you to know that first and foremost. But I want you to explain to people who are watching, especially at home, what do you mean when you say that? And what do you hope that they get from this conversation?
Sure. In terms of the community, I'm very proud of where I grew up, I tell people I was born 5.5 miles away from where I live. I returned to the neighborhood because, growing up there, everyone said you have to get out of here and move, that's how you
Yeah.
make it in life. And so when we started having conversations with parents in the community to start this organization, it was like, we didn't tell them that they needed mental health services. They told me as a co-founder and some of our other co-founders that, these are very faithful people. They were in the church, they were in the schools, they were already involved. And they said, we need more. They're actually the ones that said, hey, we realize we can't help our kids. And so it really came from that. And when I talk about the community, it's like listening to what they have to say, because I can tell you that we are not, they're being told, you have this diagnosis, you have to go seek this provider. And to be honest, most of our Latino families, and especially those that are Spanish only speaking, they really don't know where to turn. So that's what I mean in terms of, bringing this community. That's why we called it Community Does It, because we said, we don't have a name for this. And we said, you know what, we're going to call it Community Does It. And so we're fully operating, but startup still.
But we love it all the same. I love how you said fully operating, but a startup still. That's really awesome. Francis, you're with a community outreach center that does so much for the community. Let's talk more about how you're doing that outreach, and you're not just inside of a building, but you're moving from place to place and person to person.
Well, we move from place to place and person to person as a result of us launching programs like Uniting Families. Our Uniting Families program focused on mental health for families to come together, work together, and deal with that emotional intelligence. But let me go back to what Patrick said when he said just the Black community. I know another stigma is wealth. So a lot of people think that they have to be rich in order to what? Afford or be able to go toward that getting counseling or seeing a therapist. So those are the two things that when we introduced Uniting Families and we had our therapists to come in and really talk through Zoom, which really helped, because guess what? You didn't have to turn on the light. You didn't have to come in. You understand? It allowed them to connect. 76 people were on a Zoom call with therapists for 6 weeks. Unbelievable.
Yeah. And I often ask, and I go to therapy. I don't mind telling people that. I think it's one of the most important things that you can do for yourself. Even those little cards on your table talk about self-care as not selfish. You may not have anything to say that day, but just the fact that you just have a once a month check-in with somebody who doesn't see you every day, who can talk to you about what you might be going through, what you might be feeling. And that person oftentimes will say to you, well, it's fine. What you're feeling is fine. But then you're spiraling out of control because you thought that it wasn't fine. So I want to ask the group here, what are some of the things that we can look for in our friends, in our family members, and our coworkers that may be more than just, I'm having a bad day? And anybody can answer to that one.
Well, for me, my daughters, they're 27 and 23. It's the meltdown, when they're going through a meltdown, being able to recognize what's happening, and also being able to say to them, look, take a breath, take a step back. Do you need to talk? Do you need to communicate? Knowing that they could pick up the phone and have that conversation, either with me or the therapist, because life is overwhelming at this point for so many people. And because it's overwhelming, we have to give each other that support needed in order for us to function every day?
I would say, a couple things. I know that a change in mood, also a variation in appetite. A lot of times people want to just kind of focus on the person that's not eating, but sometimes a person can be, it's the reason why they call it comfort food. Okay, so how you're eating. But then we do a lot with men at our foundation. And one of the things that we kind of focus on is when you have a loss of interest in something that you just enjoy. And that's even sex. I mean, when you lose interest, you don't want to do anything. You just don't have that get up and go about yourself. That could be a sign that something is wrong.
Well, something I was going to mention was for us, it's building trust. So we're coming into a community where we don't have, this is the first mental health clinic, the first place that has a door, brick and mortar, right, where they can come and seek therapy. And for us, it's building that trust through workshops, letting them have expression. We have a workshop called Arts and Emotions, so they're able to find different outlets. So maybe it's not coming fully forward and asking like, what is wrong, or what do you think, or referring them to the counselor. It's, building that trust through the cultural competent methods that we have. And then it's also connecting them to resources. One of the biggest challenges is that, you mentioned interest, right? Or food even. A lot of our community members are food insecure. They're struggling with their family situation. They're immigrants and they're worried about their, documents or someone the police stopping them, or simple things that sound simple to us, but they really impact their mental health.
I would say just noticing, right, what's happening. So if you have people that are constantly negative, right, and maybe they weren't always negative and they isolate and they don't have any positive thing to say, like you can see from research, those are the people that are struggling, but maybe not saying, hey, I need help. They can't see that the glass, maybe it's half full. It's always half empty. And so just keeping an eye and like noticing any kind of change in people's behavior. So that means you're gonna have to like wake up and pay attention, right, to what's happening around you. But that's what I would say.
And how do you do that? Because I love the way you put it. Everything is overwhelming, right? So if everyone is overwhelmed around you and we all are going through, maybe not the same exact thing, but we're all going through something, how do we destigmatize mental health at the same time, making sure that everybody's getting the mental health assistance that they need? And maybe that's the question of the night. What do we do? Because we're all kind of struggling in this together.
Well, I recommend two things. And one of them is we need to start having some courageous conversations about it. It's not something that you just sit around and talk like you talk about a football game or sorority meeting. We need to start having some courageous conversations about what this is. And then another thing that I want to recommend to everybody in here, because it is overwhelming for all of us, is that you have a trash day. A trash day. Tomorrow's, where I live, is trash day. So tonight when I get home, we're gonna get all the paper plates, water bottles, food that's spoiled, rotten fruit. We're gonna get all this stuff, put it in a bag, and in the morning I'm gonna take it and put it on the curb. My question to you is, when was the last time you emptied the trash in your life? You need to have a time when you can take out the trash. And think about what trash is those things that are no longer useful to you in your life. Have a trash day.
Well, we could just close it on that. Let's throw all our trash away. We're all going home. I love the way you put that though. That's wonderful. When I think of trash day, I used to have a friend who used to keep going back to her ex-boyfriend. And we would always say to her, like, why do you keep going back to, like, I'm not calling him trash, but I'm saying, like, when you take the trash out to the curb, do you like go get the trash and bring it back in the house? Nobody does that. So why would you do? That's a great idea. So now that we've talked about taking out the trash, how do you, when you get home, or maybe with people at your job, or maybe friends that you're very close to, family members that you're close to, how do you have the conversation with them and say, you know what? Something's not right with me. I don't know what it is, but something's up. It's been happening for about a month now. I'm now taking out the trash, but now I'm trying to have a courageous conversation. Now what? Anybody? It's like pop quiz.
I try
on
to
you.
have that with my staff, to be honest with you, because there are moments when I know they're beaten up. You understand, because things are just so overwhelming and people need so much from them that they're not able to give. And so to have those courageous conversations, you have to say, now is the time you got to take care of yourselves. So if that means that we have to change the schedule, I need you guys to take care of yourselves, because if you don't come in, the community won't have the right team of people. So, and I'm a big encourager of my staff, because I know we're a small staff, but if we don't take care of each other, we're in trouble. And so I have to, as the leader of the organization, realize that when the problems come in, the issues come in, it becomes so overwhelming that I have to tell myself, okay, let's take a breather. I might even cook some gumbo and some jambalaya.
Did you do that this evening? And did you bring any with you?
That's
None
my,
of those things. Okay.
you know, I will cook some Louisiana food and just treat them to say what? Thank you. I appreciate you guys for showing up. Because without you, we're not the Zan Wesley Holmes Junior Community Outreach Center. And we have to do that. We have to do, I always say, we gotta love folk. We gotta love people where they are. And once we begin and continue to love people where they are, you're gonna see people then will be able to come forth, like you say, trust, and begin to say, hey, I need help.
Yeah.
I think part of it is when they come and tell you these things, it's not, okay, great, like you must be bipolar, right? And saying like you have a
Yeah,
mental
there are a
illness.
lot of words being thrown around
Right.
these days. And I'm like, how do you even know what that means? Like, you don't
They
know what
don't.
that looks like, you
They
know?
saw a TikTok.
Yeah, exactly.
Yeah.
Seriously, though.
But I think you don't have to have a mental illness to seek help. And so finding like in that piece of destigmatizing what we're doing is saying, if you just want to go talk about what's going on, go do that.
Yeah.
Like go talk to a person that doesn't have any vested interest in your decision.
Right.
So they can give you their honest feedback or say, you know what, like what you're feeling is normal, and, you know, stop looking at your phone and stop watching TikToks and self-diagnosing and go outside and eat good food.
Love all of it, all of it. What I'm hearing is what we hear on an airplane all the time. Put on your oxygen mask first so you can breathe to be able to help another person to breathe. So what do you all do to take care of your mental health? I mean, you all are medical professionals, you're mental health professionals, you're doing this for a living. You all are on the front lines of this and you're seeing it every day. How are you taking care of yourselves? What can we learn from you today?
Meditation. Meditation is my thing.
Wow.
Just to sit in tranquility and meditate and just release. Meditation is mine.
Okay.
I love to garden. I love getting out, gardening out yesterday, you know, picked some collard greens yesterday. My watermelons are up. So, I mean, that's me. I'm out there and my wife knows something is wrong if I'm not spending time in my garden. I got a green tiller that's falling apart, but that's my therapist. And so I spend time with that, doing that.
For me, I practice breathing exercises, which is along the same lines as meditation. You know, sometimes it's like, we talked about gut health earlier. I'm like, oh, you can feel it there, right? And then you know, in terms of the community members, I'm always telling them like, well, you know, I try to flow through life most times. And I think I grew up with the mindset, just like a lot of them at the community does it. It's like, you got to grind and hustle and do all this, right? For the families. And ultimately I'm like, well, doing what we enjoy, some of, like everyone mentioned here. And so breathing exercises, bringing my authentic self, because whenever I have issues, it's like, I'm only human, right? And so mental health is health. And so I keep telling people it's okay to not be okay, but we'll be here for you.
And speaking of people being there for you, Kimberly, how does someone go about choosing the right medical professional when it comes to mental health struggles?
If they have the opportunity, I suggest they talk to 2 or 3 before they
So
decide
it's like
on
an
one.
interview process.
Yeah,
Okay.
because your personality may not mesh exactly with somebody else's personality, or they may not be doing therapy the way that you were
Mhm.
wanting it. And so I always tell people, great, talk to me. Like, here's a few other people, go talk to them. And I think they appreciate that, right? They don't think you're just trying
Yeah.
to say like, you're all mine,
Yeah.
right? Because there is, well, there's not enough therapists, but there is a therapist that can help them and that can like
Absolutely.
have a good relationship, because if they don't have the right therapist, the trust is unable to be built. And then you're just going to be spinning your wheels for a very long
Yeah.
time.
And it's on both sides of the spectrum, right? I had a friend one time, she used to tell me that her therapist told her all the time that she was right. Yeah, that was 100% of the time she was right. I said, wow, you're paying this woman how much? You're always right. She said, yeah, she says that everything I do, you know, like every time I have a conversation with somebody, every time I've done this, that I'm the one who's doing the right thing. I was like, wow, that's exciting. And what do I like as a friend, you know, you don't want to be that person, but you're like, nobody's right 100% of the time. There's a problem with her telling you that you're right 100% of the time. So I like the interview process, just kind of getting a gauge on who they are.
Well, and if you've been seeing the same person for a long time and you've kind of stopped, it doesn't mean that they're a bad therapist. It means that you might need a change so you can engage in actively changing
Yeah.
yourself. So it doesn't mean that if you've been seeing them for 10 years and you're kind of where you were 6 years ago,
Mhm.
maybe it's time to switch.
Yeah. Now that can be scary for someone, you know, when people, it's kind of like retelling your trauma all over again. You know, a lot of people don't like to do that. So I've told one person, I'm just going to tell you, Kimberly, I don't ever want to have to repeat this again. But I see what you're saying, that could just, it becomes now it's run its course.
Well, I would say you haven't dealt with that trauma if you can't say it again.
Wow, that's powerful though. Think about that. That's powerful. Say that again. Like you haven't even dealt with it if you can't repeat it again.
Right. Like that's how we tell, right? Like how well you processed it. If you can get through telling it and you're not holding back your tears,
Wow.
but you've changed your mindset about it. Or, I mean, some things are just bad, right? That happen, but you can be like, it was real crappy and I'm sorry. Like, but you know, here's where I am now. And they can talk about it without spiraling into like a dark place.
Mhm. What does physical activity do for mental health?
I think it depends. You know why I'm gonna say that? Everybody reacts differently to physical activity. So we have some super hyper people where physical activity gets them all hyped up, but then they have a downer. You know what I'm saying? Whereas then you have your group that physical activity, dancing, or certain types of activities give them that uplift, that joy. So it's gonna depend. But like I tell people, I said you need balance. Balance is the key. Don't overdo it, but just try to stay balanced.
Speaking of balance, that's one of the things that we saw in the slides is sometimes your mental health can depend on your diet and what you're eating. More on that, Prisma. What are we looking when we talk about the diet and it's not so much that it's a caloric deficit, but what are you talking about when it's affecting someone's mood?
Well, in terms of food, in particular with Community Does It, I mentioned it's a collective impact project. I come more from the social impact lens. That's what I do professionally, and this is my passion in terms of the organization. But with food, we realize like there's a lack of access of food and even mental health, right? Which I explained. And then the reality is food is so important, right? And it brings together community, at least for the Latino community and many others, right? Bringing food together and sharing. And it causes conversation. So for us, it's how can we bring food and even healthy eating concepts, because we realize, well, this is a work in progress, right? So let's work on the foods that you enjoy, and then we can share more about what maybe you can consider changing. And even if it's a very small change, that could potentially impact, you know, your chronic diseases, for example, because I mentioned the zip code because it is one of the highest. If you look at the Parkland Needs Assessment, it's one of the highest in terms of chronic diseases and also aging population. We have a shorter life expectancy. There are all these things that are negatively impacting us. So food is a big part of it.
Well, I mean, I think a lot of it is, it's just passed down from generations, how we eat. And I know even for myself, that's, again, starting a garden. I never thought a day would come that I'm planting broccoli and I'm planting kale. And then, but, realizing that the effect that it has and the health benefits from eating those kind of things are reducing the fried foods. And I look at it like this. When they were talking about the prevalence and the increase in high blood pressure and diabetes, and they talked about reducing all these food and not eating this, did they eliminate high blood pressure? No. Did they eliminate diabetes? No. But it created an awareness. So now people can, cut back on the fried foods. So I think the same thing with what she mentioned about how diet impacts our mental health. It will create, if we talk about that more, it will create that awareness that if I do this, be better outcomes.
Yeah. It's a tightrope that we're walking these days with all of it, right? And it's just, you're trying to make sure that you're okay. You're trying to make sure that your neighbor's okay. I wonder if it's possible to have some real tools that we can take with us, because I know I've found myself in this situation. I can only speak for myself, but I feel like somebody's going through something and I feel like it's a really bad something, but they're also my coworker and I don't want to cross that line, because the second you say it, it's like, so are there ways that maybe we can approach it? Because I just have so little time in a day, y'all. I'm such a straight shooter. So I might look at you and say, hey girl, you okay? You're good? Cool. And then I just walk off, but maybe being more intentional about when you say to someone, how are you doing? Like, how are you doing? You actually look at them, you make that eye contact and have that moment. How can we be better for that?
Well, so I do pact therapy with, well, not with Deb, but just like Deb. She's more trained than I am, but it's like intentional how you ask the question, right? So if you're asking your friend, hey, are you okay? Why are you asking that? Like, what's making you ask that? You might say, hey, are you all right? I noticed you've been like in your office with the door shut for a few days, right? Because if you tell them why you're asking that, they might give you a more clear answer, because then how are you today? Fine is the answer.
Yeah.
It's what everybody says. I'm good. I'm fine.
I'm here.
Yeah.
Made it
Great.
here.
Are you just here? Right. And so I think maybe making a joke, but then like kind of taking a serious angle, or just being intentional about how you ask the question. Because if I'm talking to someone, I'm like, you're just on your phone all the time. You're in your, you're really like you've been more negative than like you usually are. So I'm concerned. They may be more willing to talk to you than if you say, hey, are you good? Okay.
I want to say we have a thing in our foundation that we tell people to ask twice. Because like you said, generally that first meeting is how you doing? It's a rhetorical question. And like, she said, we feel we have to say, I'm doing good. I'm doing right. Okay. Then later on, okay, now tell me how you're really doing. Always ask twice.
Wow. And it sounds so simple, but maybe that really is where it really hits them. Anybody else on that one?
I have something in my head.
Give it to us. We can use all the tools that we could use.
Well, I think, and I think about it, I reflect upon it even personally, like, how do I approach people? How do I want to be approached? And so I can tell you just from my work in the community, it's always been like, going back to trust, right? Building those relationships, because, I think so often, in particular, in corporate America, which, I work there too, it's, these conversations that you have at the water cooler, right? You have at the coffee machine, and we don't show our true self. So going back to the way we've pivoted because of the pandemic, like, how can we be more authentic in ourselves and share that with others so that people can open up for us? And so a community does it. That's been the primary driver of this work. And, the people have really been leading it. And so I always tell people, like, well, people now have found me to be so approachable that they tell me, that they're not okay. And I'm like, I'm not either. So let's work on this together. And so, and then we're finding our counselor or connecting to those resources. But, that's my approach with everything. And coming from organizations like SVP Dallas, that was like, let's be intentional and deliberate about everything. And get to the core. So that's how I approach life and I approach this organization.
And maybe just encouraging people not to believe everything that they see all the time. It's just so many young people. We go to these schools, we go to high schools, we go to colleges, and it's incredible what young women think that they should look like. None of them think, like if you look at a picture from 25 years ago of just a girl in high school, now you look at a girl now in high school, it's really scary. Yeah. The filters for one thing, I was just showing my mom some filters one day, like the butterflies and just showing her what it was. She likes to troll Instagram. That's all she does. She doesn't post. But she was just like, wow, I wish I looked like that in real life. And my mom is my mom. I think she's beautiful. But at 64 years old, she's like, I want that face. I'm like, so you can imagine what that's doing to a young brain that's still developing, right? So that's one of the things that I just encourage all of you, anybody who can hear me, anybody who's watching at home, if you can encourage a young person today to spend 10 less minutes on social media and 10 more minutes reading a book, taking a walk, doing anything other than that, I think we could start. That would be a really great place to start. Listen, I have had so much, this has been such a joy to be with you all this evening and you all as well. The insight that we've gotten from you this evening has really, truly been good. I want everybody to just leave us with a parting thought. Patrick, let's start with you.
Well, I've heard it said up here, I want everyone to understand that it is truly okay not to be okay. You need to make sure that you're doing what you need to do to take care of you. The oxygen mask, the stewardess information at the beginning of the flight is so true. And always remember, you cannot pour from an empty pitcher. So if you're not taking care, I'm sure all the people that are depending on you won't be taken care of because you're not taking care of yourself. So self-care is not selfish.
And after self-care, great support systems. Make sure you connect with the right people so that you can depend upon them. No man is an island, and we are better together.
I think moving beyond just self-care, but self-compassion, because when we think about the people that we love, and we all have someone that comes to mind when I say that you have your mom, you have your dad, your children, and would we speak to them in a way that the way we speak to ourselves sometimes? And so always knowing that we're enough, that we should treat ourselves like someone we love, because we're out there giving to everyone. And then personally just taking that time to reflect. And then I tell people, I talk too much, but it's because I'd rather over communicate than not, and I want people to know how I feel about them. And so constant words of affirmation for the community members.
I would say balance, like find some balance, right? It's eat healthy. Okay, but if you eat some French fries one day, okay, like that's okay too, right? So like it's about balance and like finding like your sweet spot, which can be hard, but taking a minute, say, am I working too much? Is my phone always messaging me? Like, so turn your work off for the weekends if you can, right? And finding some balance.
I love that. Thank you all so much for your time. This has been really good. I'm going to take my trash with me. Patrick told me to.
Y'all can get off the stage now. I'm kidding. I'm messing around. No, thank y'all so much. Give it one more time. Give it up one more time for our panelists and our moderator, Laura Harris. That was absolutely awesome. Great conversation tonight. incredible stats, information, and data about what mental health is looking like inside of our community today, right now. And this does not just stay right here in our community that in North Texas. This is happening all around. No matter where you go in this world, if you're traveling this weekend or in the future, know that you can take these tips and everything that they were saying up here into any community that you enter. But if you want to slide me over. So now what? The next thing is, I'm just gonna be like, bam, there it is. All right, so May is Mental Health Awareness Month. Just so you know, a couple quick stats. These were posted actually by the Communities Foundation of Texas the other day on their social media handles. So 1 in 5 kids, I'm used to the hunger thing. 1 in 5 US adults experience mental illness each year. And that's 67% of US youth. 6 to 17 experience a mental health disorder each year. That number is like 67%. There's some kids that stand outside of my house waiting for the school bus every day that I actually just sit there and talk to. And just to know that they're going to school and I don't know if they're getting bullied or like what's going on in those, but those same conversations that they were having with others and how you ask them questions, do it to the young generation as well. We don't understand sometimes what they're going through because sometimes they hold it in a little bit more than we do as adults. All right, 1 in 20 US adults experience mental illness each year. And then suicide is the second leading cause of death among people ages 10 to 14. Just another staggering statistic about our youth. And if you want to go ahead, one more. And then 50% of all lifetime mental illnesses begin by the age of 14. So when we start talking about the youth, a lot of this stems from early ages beyond that. You can go ahead to the next one. I think I actually left my last slide over there, but looking for my notes over here, I'm going to grab it really quick. How are y'all doing? Does anyone have any questions for any of our panelists while they're here? Anyone? Going once? Cool, because I wasn't going to give you a mic. You can stick around afterwards for that. But I did want to make this announcement for the Communities Foundation of Texas. So the Communities Foundation believes that health, including mental health, is a pillar of a thriving community. And in honor of Mental Health Awareness Month, our partners at Ramesh Kalpana Bahati Family Foundation are supporting North Texas nonprofits working to advance mental health and behavioral health. Our nonprofit community is experiencing an influx of mental health support requests in response to current community challenges and tragedies. Throughout May, the foundation, the RKBFF Foundation, will be furthering the impact of donations made through North Texas Giving Day to a selection of local nonprofits. With every gift of $15 or more, the Bahadia Family Foundation will add an additional $15 donation. Additionally, the small and medium-sized nonprofits with the most unique donations will receive $5,000 in gifts. A special thank you to the Family Foundation for its support of North Texas Giving Day and local mental health initiatives. In 2022, the RK Bahati Family Foundation served as the inaugural North Texas Giving Day cause sponsor for mental and behavioral health, awarding Bahati equity and wellness grants to a number of organizations. We'll be sending a follow-up email to this with actual information on how you can be more part of North Texas Giving Day. That's on September 21st this year. Coming on up, it will be here before you know it. If you know a nonprofit in the North Texas area, registration closes within the next week or two. So make sure you jump on that. I believe all of our organizations that were up here tonight are all registered and are all part of that, except for Curis Functional Health. So now roll to the next slide. Good segue. So how can you actually help with Curis Functional Health? If you know a mental health provider or someone maybe in the chiropractic space or nutritional space or someone that's looking to maybe be a DNA-based weight loss coach, we are always wanting to bring team members onto our team and expand the mission for whole body wellness and mental health. So if you know of anyone that's an LPC, LMSW, has some cool letters that I don't have behind my name that's actually working towards this every single day like Kim and Deb, please let us know. You can speak to myself, you can speak to Deb, Kim, Mark over here in the jacket, and we can get more information over to you for that. Outside of that, There is a lot of food back there. Even the online folks, stick your hand through the camera or something. There's a lot of food in the back. Feel free to grab for yourself, your kids, wives, spouses, whoever's in your life. Go grab some food. Thank you so much for joining us for our first ever Destigmatizing Mental Health, and we'll be talking to you soon.